Now, we often get emails from you asking for more stories about complementary medicine. And one reason why we don't do a lot of stories on complementary therapies here on Tonic is that there's not a huge amount of scientific research into them. But that is changing. And in fact, we recently went to one of the world's leading cancer centers, the MD Anderson Cancer Center in Houston, Texas, where they've been researching acupuncture to treat serious side effects of cancer therapy.
Head and neck cancer patients who undergo radiotherapy or chemoradiotherapy for their primary treatment end up getting a horrible side effect called xerostomia. So this is essentially chronic dry mouth. And although this may sound relatively benign, just having a dry mouth, it is quite problematic for cancer patients. They end up having difficulty swallowing, difficulty eating, difficulty speaking. It disrupts their sleep. And most importantly, with decreased saliva flow, you have an unhealthy oral cavity.
So it's a really miserable symptom.
Yeah, and so there's been some research showing that acupuncture, after somebody's finished radiation and has chronic xerostomia, can help improve symptoms and help improve saliva flow. But in this study that we did with colleagues in Shanghai, China, we were interested in incorporating acupuncture into the radiation treatment plan. And then we assessed their self-report symptom of dry mouth every week throughout radiation, and then 1 month later and 6 months later. And we also collected more objective measures, as you could call them, of saliva flow. So in a standardized fashion, measuring how much saliva they could collect in their mouth during a 5-minute period.
And what were your results?
And what was really quite amazing is that as early as 3 weeks into the study, we start to see a separation in the groups in terms of fewer symptoms being reported by the acupuncture patients, as well as significantly higher saliva flow. And this remained true even a month and 6 months after the end of radiation.
You might feel this a little bit, shouldn't be too much.
The people in your control group didn't have any acupuncture at all. And some people have said that you need to do what's called sham acupuncture, that it might have nothing whatsoever to do with the Chinese meridians and traditional acupuncture points, and it's just putting in a needle. What do you think about that?
Well, in this case, I think that the points are really important. And of course, from that first study, the acupuncture points and which ones you use. We've just recently published a small follow-up study, only 20 patients, exact same design, but 10 patients received what we call sham acupuncture. So they received real needles at fake points. So instead of inside the ear, they received needles on the helix of the ear. And the differences were actually as profound. We didn't do a 6-month follow-up, but the differences emerged 3 weeks into treatment, and at the 1-month time point, significantly different self-report of xerostomia symptoms.
It isn't just acupuncture they've been studying at MD Anderson. They've been looking at yoga too. But if yoga does have benefits in people who are going through cancer treatment, which aspect of yoga is it? Is it the breathing exercises, the meditation, stress relief through relaxation, the exercise, or what? And how do they tease these apart?
This was followed up with a much larger study, 150 women, 50 participating in the yoga program 3 days a week throughout the 6 weeks of radiation. 50 were assigned to a usual care control group. And then importantly, we had an active control group where the women engaged in stretching exercises for the same amount of time, the same frequency as the yoga group.
And what was involved in the yoga exercises?
This was a yoga specifically designed for breast cancer patients undergoing radiation that started out with around 20 minutes or so of some gentle joint loosening and breathing exercises where you incorporate gentle movements with the breath. Then they were taught seven very simple postures, some side bends, some back bends, some forward bends. Then they learned a pranayama breathing exercise, which is called alternate nostril breathing. And then we finished off the session with a gentle meditation and then a deep relaxation technique. And we found by the end of radiation treatment, actually both the stretching and the yoga group reported reduction in fatigue levels, where there was a slight increase in the usual care control group, and no differences between stretch and yoga. However, 1 month, 3 months, and 6 months later, the yoga group reported much higher levels of physical functioning, overall general health, and ability to find meaning in the illness experience.
What do you mean by that?
Well, so this is a self-report measure that essentially asks them about aspects of purpose in life, and have they been able to grow from this experience of a life-threatening illness called breast cancer. And we see in other literature that it's individuals who can somehow see the benefit that could possibly come from being diagnosed with breast cancer are the ones that do better.
Do better?
Just overall in terms of their quality of life and some suggestion of increased survival. So cancer can often give people license to make changes that perhaps they were a little leery to have made previously.
Meditation has been quite controversial in cancer. Some people say that if you meditate a lot, you really do benefit from it. And there is evidence that it changes the immune system, but the question is in which direction, for good or for ill. What do you think about all that?
That's hard to know. By having the stretching group, we're controlling for a number of things. One, the social support that you would receive in a group setting, the extra attention that you're getting from somebody on the medical staff, the extra attention from coming into the hospital. And of course we are controlling for movements, and we chose stretches that are typically recommended for breast cancer patients, but that also mirrored the asana portion of the yoga, the postures. And what is not really controversial is that meditation changes the brain for the better. So a recent study out of the Harvard group showing that there's an increase in hippocampal volume. So we're not just talking about blood flow and electrical activity of the brain, we're talking about a change in the anatomy, the size of different parts of the brain due to meditation-based exercises.